The need for nurses across Tennessee is growing. A federal study predicts a nearly 22% shortage of nurses across the country by 2030. Our Caroline Corrigan tells us how Erlanger is dealing with the problem.
That's right. I met with medical professionals at Erlanger Medical Center. They tell me a shortage of nurses is really nothing new. It's something healthcare systems across the country have been experiencing for years. Nevertheless, the need for bedside nurses remains a top priority. At Erlanger Medical Center, morning huddles for nurses are routine. Huddles that could be getting smaller. A recent study by the Department of Health and Human Services predicts a shortfall of nurses by 22% in 2030. Jan Keys is in charge of about 3,000 nurses in the Erlanger health system. She says this shortage has been a concern for quite some time.
It's just the retiring of the nurses. The baby boomers are now retiring, they're going out. So as we're replacing those nurses, you're not replacing a lot with experience, you're replacing them with the newer nurses.
She says the shortfall is due to a variety of factors, including a vast range of opportunities for nurses.
Prior 2010, nurse went to nursing school, pretty much went to a hospital or a clinic and worked. But that's not true anymore. Nurses can go to insurance companies, can go to a lot of retail places.
Angel Collier is the Associate Director of UTC's School of Nursing. She says some nursing students also don't understand the demand of the job.
It's a 24/7, 7-day-a-week, 365-day-a-year career. And some people, when they go into it, do not realize that that actually means weekends, nights, holidays, on call.
Local nurses say nearby programs like the one at UTC tend to be a pipeline for recruiting. Key says Erlanger Health System works to provide attractive incentives.
Looking at ways to help them, if it's paying tuition reimbursement, all these different avenues that will help attract your nursing students and keep them and help retain them too. So it's a continual process.
But the need for bedside nurses remains a challenge.
Nurses are being graduating. They're graduating nursing school. They're just not going to the bedside like they did in the past.
According to data from the Tennessee Department of Labor and Workforce Development, the average salary for a registered nurse in Tennessee is about $60,000. The average salary for a nurse practitioner is about $96,000. For more information, check inside our WRCB app. Reporting in the studio, Caroline Corrigan, Channel 3 Eyewitness News.